Hi, I'm John Wilson. I'm President of the Royal Australasian College of Physicians. I'm sure many of you have been keeping an eye on the unfolding COVID situation, or second wave, as some are calling it, in Victoria. As a respiratory physician working in Melbourne, it has certainly been a very challenging and concerning time. It is a reminder that COVID is still here with us and that we can't let our guard down in either Australia or Aotearoa, New Zealand. We've been in touch with the federal health departments to lend our support to measures for those arriving from overseas. We must adhere to the quarantine and testing of international arrivals to protect the work we've achieved so far. Indeed, all hotspots either in Australia or New Zealand need our immediate and undivided attention to prevent further spread. But it's not all bad news. While cases are going up in Victoria, only a small percentage of infected patients are requiring hospital care. So far, only 5%. This is very different to what we saw months ago in the early days, before we had adequate PPE. Furthermore, remember that healthcare workers are still at higher risk of COVID infection. It shows we're better equipped to prevent those in vulnerable groups from contracting the virus. But we cannot let our guard down yet. The mortality rate in new cases is also extremely low. Patients who do need care are being well managed by you. This is a testament to you, your colleagues, and our health systems. We are doing great work in both countries and are well ahead of many other nations in beating the virus, but we haven't completely prevented community transmission yet. As community leaders, I call on you to promote safe social distancing, isolation, and testing practices that are appropriate, and keep those at the highest possible standard. As medical leaders, it's important that we lead by example in our own personal and professional lives. So continue providing great care to our communities, continue practicing your own hygiene and social distancing policies, and continue to advocate for appropriate PPE, testing facilities, and optimal care for the aged and those at risk. I thank you once again.